How does productivity affect quality of care? I'm on the fence as to if it's good or if it's bad. Um, I see benefits for the companies per se when they put productivity on your schedule. And I guess it's how efficient they expect you to be while in the building. So then they put these standards as to, okay, well, if you're in the building, if you're seeing patients, if you see Mrs. Smith, and then from Mrs. Smith, you go right to Mr. Smith, the downtime in between shouldn't be significant. But in a perfect world, that's hard to do because if I have a patient, for example, that's 60 minutes and I work with this patient, and from this patient, from the time I'm done with this patient, I go to the next patient, Mr. Smith, and Mr. Smith is with the nurse and they're doing some kind of treatment. Maybe it's meds, maybe he's getting cleaned up by the CNAs, then that will affect your overall productivity. So most of the times what you would do is you would leave that patient, okay, who else do I have? And now you go down the hall, you get the next patient, and hopefully they're ready. But there are so many variables throughout the day that sometimes it's difficult to be within the parameters that they set. Or a patient may go out to the hospital, and or the ambulance may be coming while you're doing the treatment with the patient. So there is many variables throughout the day, and not even something that extreme like going out to the hospital, but just let's say a patient is performing an activity, and because this patient is doing an activity that they're somewhat independent with, you may take that time to do your notes. But you take your eyes off your patient, you're really not monitoring them throughout the entire session. So you may start to type your notes, and it's really not giving the patient 100% of your attention. So that's why I'm on the fence. I understand why companies would do it from a business standpoint, so that you're efficient. You don't really want people kind of sitting around on your time, basically. But on the other aspect, it's that there is variables that happen while you're working, and on a productivity schedule, and that's very hard to predict. And sometimes the percentage is very high. I know some companies do 95%, and that's fairly high. That's assuming that you have a perfect day. And I think some therapists have a difficult time. Most therapists will have a difficult time with 95, and who's to say that you are going to end up seeing the patient for the specific exact amount of time that they are on your schedule. And that's where things get a little tricky.